Hi, I'm Vannessa Fowler, and I'm a patient care advocate here in Kelowna, BC. And I'm creating this video today because I feel that I need to answer a lot of frequently asked questions I get when I'm talking about my company. A lot of people don't understand what a patient care advocate is or what they do for you. So I'm going to design this video in a sense of question and answer type of format. A little bit about myself. I'm a registered nurse. I specialize in emergency care and I've been nursing for about 13 years. The reason I decided to do advocacy is because I found it's kind of one of my niches to be able to work with patients to make sure that they are educated and they can make informed decisions and help give them the courage to speak their voice. So my business is called Nightingale Patient Care Advocacy. And the first question I have here is, what is an advocate? I basically tell everyone that we actually all come across advocates throughout our life. The most common advocate that we're very familiar with is a lawyer. Most of us don't know the legal system inside and out. So if we ever come across a point where we have to go to court, or we're being charged with something, or maybe we are going through family court, going through divorce, we hire a lawyer because we don't know the ins and outs of the legal system. Not enough that we can feel confident walking into a courtroom and be able to represent ourselves. So another type of advocate is a social worker. A social worker is an advocate for children and families. We all have probably a good general sense of what a social worker can do for a child who is endangered, and we rely on them to be able to navigate through that system to empower that child to be able to live a safe life. So when you look at a patient care advocate, it's our healthcare system that sometimes gets so complex, or maybe you're feeling like you're slipping through the cracks, or you're not being heard, or maybe you're just confused about what it is that you need and you don't know all the available tools and resources that are out there for you. This is where an advocate can come into play. So an advocate basically is someone who's going to help speak your voice or give you that courage to speak your voice, to become an active role in your own healthcare. So who hires an advocate? Now, with my company, I've been hired from all ages, people that are younger than me or who are like elderly in their 90s. So it depends on what it is and where you're at with your healthcare. Sometimes people are diagnosed with something that they're overwhelmed with. They don't quite understand their options. Maybe they have been given or appointed the job of taking care of a loved one. Maybe your mom has become so frail, elderly, maybe she's got Alzheimer's, and you have been appointed to make those decisions for her, but you're overwhelmed. You don't know what's out there for you. That is where basically I come into play, or any other advocate, is that we've been trained as healthcare professionals to know the ins and outs of the available healthcare system for you. We can take the time to educate you with all the resources that are available in your community. We can help do some research on alternative healthcare solutions and just give you all the straight facts so that you yourself can make an informed decision and moving forward. As a patient care advocate, I provide the tools and resources to teach you how to be an effective advocate for yourself or for a loved one. Make the choice today and regain some control in your own healthcare.